Skip the entire category called digestive bacterial because I'm tired of talking about diarrhea. That's E. coli, that's salmonella, we already been there. Now, we're talking about the category called digestive viral, beginning with the mumps. The mumps is caused by a virus that's called the mumps virus. No fancier name. The mumps virus. What kind of gland is a parotid gland? It's a salivary gland. Good, salivary. So beneath the ears, about right here on me, is our largest salivary gland, called the parotid gland. Now this virus targets for infection the cells of the parotid salivary glands. Those glands swell up in a big way. If you have your book handy, on page 721, it shows someone with mumps. In his case, just the right side for him is swollen. Sometimes one side, sometimes both sides are very swollen and very, very tender with the mumps. Now, usually there are no complications. You wait a while to get over it with the immune system fighting back. I want to mention, though, two possible complications here. It can become, in some cases, meningitis. Not usually. The viruses wind up in the meninges in some cases. Also, for males, it winds up sometimes being orchitis. Now, if we say orchitis, it's inflammation of, infection of the testes or testicles. So some males have become sterile because mumps became orchitis. Again, those two complications are not very common, but they sometimes happen. How do most of us avoid the mumps? It's called MMR, measles, mumps, rubella. Next up is the condition called hepatitis. Hepatitis. You should know that HEPA means liver. Inflammation of or infection of the liver. So some people wind up here on a waiting list for a liver transplant. Is that serious? Now, if someone picks up one of these viruses, and by the way, this is caused by three viruses mainly. They're called hepatitis A, hepatitis B, hepatitis C. The three main causes. They're called just A, B, and C. If you pick up the hepatitis virus, you're going to have some fever, probably some nausea initially, probably weakness. So initially you may have some fever, nausea, weakness. That'll go away. The big question is, what's going to happen long term to the liver? Some people have the liver over time destroyed. If you have your book there, look at page 724. 724 shows on the left a healthy liver, on the right a hepatitis liver. It's all changed and basically becomes non-functional. And we want to realize that we cannot live without a functional liver. We cannot. So some folks are on the waiting list for liver and sometimes they die. Now let's compare these three main causes in a chart. We're going to try a chart. Comparing hepatitis A, B, and C. We'll put the type first in our chart. A, B, and C, these viruses. What's the route to pick up that virus? The percentage chance of being a lifelong carrier of the virus, a lifelong carrier. Can the virus lead to chronic liver damage? Also CLD. That's chronic liver damage. Can the virus trigger a case of LC, liver cancer? Liver cancer. Finally, on the chart, is there a vaccine? So the route to pick up the virus, called hepatitis A, is fecal oral. You ingest food or water, probably food, that's contaminated. This is a food poisoning type thing. So an outbreak at a restaurant or a quick stop store is an A virus. The route to pick up B and C is body fluids in both cases. Infected body fluids. So B and C are picked up in similar ways as HIV is picked up, body fluids. The chance of being a lifelong carrier of the A virus is 0. The virus is taken care of quite well by the immune system. Unfortunately, for B and C, there's a 20 to 30% chance you'll carry around some of those viruses for the rest of your life. There's a chance. The next two columns sort of follow from that. So under hepatitis A and chronic liver damage, I'd put down no. Doesn't tend to do that. However, B and C is yes. They can cause some major liver damage, like the book shows. That's C virus in the book. Liver cancer is the same thing. A, I'd put no. Doesn't tend to trigger that. B and C put yes. They sometimes trigger a case of liver cancer, B and C. There is a vaccine for the A virus. It's called inactivated. Messed up viruses is your vaccine. Is there a vaccine for B? Yeah. It's called antigenic fragment recombinant. They give you just epitopes. No risk. So a totally safe and a very effective vaccine for B. The really bad news up here is there's no vaccine at all for C, because the C virus mutates and changes so quickly. The biggest problem here these days is C virus, because it changes so quickly, there's no vaccine. I want to mention that if some person has this problem up here, especially B and C, the treatment they tend to get with B and C especially is interferon. Anybody heard of interferon? This drug slows down the virus. It basically saves liver cells. Slows the virus down and saves liver cells. And maybe, over time, maybe it saves the liver. That's the idea. So we may get some questions, multiple choice there off the chart. Now the last chapter, 26, on the very top right in the handout, top right. This chapter is on urinary infections and reproductive. We're going to skip urinary because that's UTI and stuff that's not it. Let's finish up with some so-called STDs, the sexually transmitted diseases. Beginning with some that are caused by bacteria, it says chlamydia. Now, chlamydia is the most common STD, most common. It's caused by an organism called Chlamydia trachomatis. Chlamydia trachomatis causes the problem. I think I mentioned a while back to you all that the majority of people who have chlamydia have no symptoms. No symptoms. They got the infection with no symptoms. If some person does have symptoms, it's going to be a painful urination and maybe a discharge, kind of greenish yellow, from the urethra, males, or vagina, females. If they have symptoms, it's a painful urination, maybe a discharge from urethra or vagina. Now the handout says CO, which is complication. As I mentioned a few weeks ago, a serious complication here is sterility in females. Some females become sterile because of untreated chlamydia. It may have been no symptoms or mild and didn't take antibiotics, and it's a problem sometimes. The cure, it says cure, is of course antibiotics. If you know you have this, if you go to the doctor, then take antibiotics. Take care of it. Next up is gonorrhea, caused by Neisseria gonorrhea. Again, the species name is in Latin up here with the extra vowels. This time around, the majority of people do have symptoms. Not everyone, the majority do have symptoms. If some person has symptoms here, it's the same thing, exactly. It's a painful urination, again, and a discharge, perhaps, from urethra or vagina. If they have symptoms, majority do, it's the same thing. A painful urination, maybe a discharge from urethra or vagina. I want to mention for our test anyway, one complication as possible. It's eye infections for a baby. Sometimes the mother has gonorrhea and the baby picks up bacteria in the eyes when they're born. It's a serious eye infection. That's also possible for chlamydia, you mentioned that. But I'll mention this real quickly, not for your test. Most countries, a baby gets erythromycin eye drops. This takes care of these problems if they're present. Some countries don't get the eye drops so much. These are real problems here. The cure for gonorrhea is, of course, antibiotics. If they know they have it, if they go to the doctor, they take antibiotics. Now, if you have your book there, if you want to, if you're brave enough, there's a picture on page 749 at your own risk of a male who has gonorrhea. 749 shows a male with gonorrhea. That's the discharge I'm talking about on that page. Next up is the one called syphilis. Syphilis. This is caused by an organism called Treponema pallidum. This is the one that causes syphilis. Now, I mentioned a while back in lab that there are 3 stages of symptoms that some folks go through. The first stage is chancres, the so-called gentle lesions. It always starts out as gentle lesions called chancres. Now, some folks take penicillin and it goes away. If not, stage 2 can happen, which is called skin lesions. I mentioned a while back that these are round and they're on the palms of the hands a lot, the soles of the feet. Then stage 3 is called, I should say, gummas. Remember, a gumma is a very destructive lesion, as in part of the body eaten away by the infection. The biggest problem there is that the gumma affects the brain. So picture a part of the brain eaten away. That's a major problem. Now, when your handout says complications, we're going to do stage 3 complications. Down here, the complications are insanity, or brain lesion, and death. The complications of stage 3 syphilis include insanity and death. If they go to the doctor, then the cure is antibiotics. Now, if you want to, look at page 754. 754 shows all three stages. It shows a male with a genital lesion. It shows the skin lesions on the palm of the hand there. It also shows gummas on the forearm, very destructive. So 754 shows all three stages. The last stage being a major problem. Now we'll talk about some that are caused by viruses, beginning with genital herpes. This is caused by a virus called herpes simplex 2. There are quite a few of these viruses. The most famous ones are 1 and 2. 1 causes cold sores, and 2 causes genital herpes. The patient here will have genital lesions. They will tend to go away, but they might reoccur. Remember, these viruses go to nerves and hang out latent. So they can reactivate and be a reoccurrence of these genital lesions. A possible complication here, which is not very common, encephalitis. In rare cases, the viruses go from nerves to spinal cord to brain. Not usually. What is the cure for genital herpes? None. None. It makes a big difference if it's caused by a virus. There's no cure here. Next up is, I'll show you a picture, I guess, and give you a chance. It's on page 757. It shows a male with genital herpes. 757. The genital lesions. Now the genital warts. This is caused by the same virus that causes all warts. What's it called? HPV. Good. Also called the human papillomavirus. HPV causes all warts, including genital warts. What is a possible complication? Cancer, especially cervical cancer in females. A definite link there. I suppose there's a cure that can sometimes work. Pretty sensitive area, of course, but aggressive removal of the wart or warts can sometimes work. Now, page 758, 758 shows a female with genital warts. 758. Not to write down, not for your test, but I want to mention there's a vaccine for this now, which we hope cuts down on the cases of cervical cancer. Last but not least is the condition called AIDS, caused by HIV. The complications would be mainly numerous secondary infections, especially, remember, tuberculosis and pneumonia. Another complication is death. Of course, the cure for AIDS is none. I think there'll never be a cure for AIDS. We can't cure the common cold. I do think in our lifetime we have a vaccine for HIV. They're trying new strategies all the time. Not for your test, I'll mention the news, the latest thing. They're now giving people some genes to make in their own cells the HIV epitopes I've been drawing. The person makes these, a whole bunch of them, then they also make memory cells and antibodies. So trying a new approach of giving people genes to be a vaccine, if you will, make those proteins. We'll be turning back to your chapter 21 notes to review all this stuff. Turn back. Let me summarize the entire semester. To be perfectly safe, don't eat any food, don't drink any water, don't touch anyone, don't breathe the air. Pretty much take your finals and then lock yourself in your house. So, I hope you understand, though, seriously, how bacteria and viruses work better now than you did back in August. Understand how we fight back against them. Now, some reminders about the final exam. It's going to be when? Next Wednesday. Now, next week's a different schedule, which means Monday we don't meet at all on Monday. So next Wednesday is our final. You see a schedule like this, it says 8 o'clock. Now we're going to start at 9 o'clock, right? So next Wednesday at 9 o'clock. Now, not 9:30. Be careful, I'll tell you the time. Not 9:30, 9 o'clock. Now, it's important to me that we all have the same amount of time to study for this test. So my policy is, if you're more than 10 minutes late next Wednesday, you miss it that day, you can take the final exam late. You get full credit if you have an emergency reason why that happened. Like one student a few years ago was having a baby that day. That's a good reason. Also, being in a wreck, being in the hospital, that's a good reason. Maybe a note, I can make a phone call to verify the reason. That's going to be full credit, that's okay. If you're more than 2 minutes late and you don't have a good reason, emergency reason, you take a test and have 25 points taken off the grade. So if you show up at 9:30, because that's our usual time, that's going to be a real problem because schedule mixed up. So here at 9 o'clock, next Wednesday sharp, once you bring 2 Scantrons, or it's better to do 2 Scantrons. I'm going to hand out that day the non-comprehensive part, then right after that, the comprehensive part. So right away, you're going to get both parts that day. Once you're finished with both parts, and on the way out, turn all your stuff in, both parts, as you leave. A reminder on the comprehensive part of your final, comprehensive. You study the multiple choice questions off your old tests, your 4 test papers. Except what? A and B are both correct, B and C are all of the above. Any of those you're going to mark out. Doesn't matter if it's the correct answer or not, doesn't matter, mark those out. That'll cut down somewhat what you have to study there. And I have the same question as it was last time. The order of the answers is usually different. Don't memorize it's C again. Memorize it's going to be the correct answer. You can do highlighting, kind of quiz yourself how you want to, but work on those questions. Now, that means if we have 4 old tests, I'm going to pull off 12 to 13 of those off each old test to make 50. That part takes the place of 1 missed lecture grade, right? That part takes the place. That's going to count twice for some of y'all. The non-comprehensive part is going to be 40 multiple choice and 2 discussion questions off this handout we'll review now. So I'm going to average the 2 parts together. So the final exam is going to be 100 points. It's longer than usual. It's going to be 100 points. Just like everything else in the lecture exams. Now, in chapter 21, we better start out with the first possible discussion question at the bottom. If I choose that one, you can tell me things like Staph aureus causes pimples and boils and a sty. These are all Staph aureus infecting hair follicles. It also tends to cause impetigo in a newborn baby. It also causes scalded skin syndrome. It also causes toxic shock syndrome. I'll list those. Strep pyogenes causes one called erysipelas. I want you to mention that erysipelas goes to the dermis and might cause scarring. Also, impetigo for not a newborn is probably strep pyogenes. Also, necrotizing fasciitis is one particular strain of strep pyogenes that's a flesh-eating bacterium. I want you to mention something in your answer called exotoxin A. Eats through flesh. Now back to multiple choice. The very top. Now on your test here, I tend to ask some questions that are very straightforward. For example, I ask, what causes smallpox? And the answer is variola. That's the virus, variola. As usual, I want you to focus on just what I mentioned here to study. Why can smallpox be fatal? The infection of, the shutdown of internal organs. Chickenpox is caused by a virus called varicella zoster. This is a herpes group virus. It goes to nerves. It's latent. If it reactivates later in life, then you have shingles. Now, this virus crosses the placenta, but I didn't mention that. So mark out placenta right there after shingles. I didn't mention that earlier. Not very common. Now the so-called regular measles. The regular measles. This is caused by a virus called rubiola. Rubiola. This rash is a bumpy or a raised red rash. The complications include pneumonia and encephalitis. The German measles is caused by a virus called rubella. This rash is a smooth or a non-raised red rash. Rubella can cross the placenta. So a complication here could be birth defects for a baby or encephalitis. Again, just the detail that I didn't mention you're going to study. I'm leaving some details off on purpose. Now, conjunctivitis or pink eye. The most common bacterium to cause this problem is Haemophilus influenza. The most common virus to cause the problem is called the adenovirus. Now, chapter 22 on the nervous system. Under meningitis, we'll skip a few things, but it says, why can meningitis be fatal? Well, shock. Blood pressure is too low. The three most common causes here are Streptococcus pneumoniae, Haemophilus influenza, Neisseria meningitis. The most common cause of this is Strep pneumoniae. The most dangerous form of this is caused by Strep pneumoniae again. Now take a look at the second possible discussion question. If I choose this one, you've got to write about listeriosis. This is caused by a bacterium called Listeria monocytogenes. This one here is picked up by a route called fecal oral. It's food poisoning. I want you to mention this. It can do binary fission quickly in a refrigerator. It sometimes winds up in hot dogs and lunch meat. With a good, strong immune system here, no symptoms. A compromised system, it may mean meningitis. This bacterium can spread cell to cell, can cross the placenta. I want you to mention this to finish up that part of it. For a baby to pick this up, there's a 60% chance it will die. Mention that. Now, the main group B strep that causes us problems is called Streptococcus agalacti. You may have symptoms or not. To mention this, you could be a carrier of this in your digestive tract, urethra, or vagina. This one here cannot cross placenta. A baby can pick it up in the actual birth process. If they do, a 5 to 15% chance they will die. Look for those things if I ask that question. In the category called nervous system viral, polio is the last possible discussion question. Also got to write this out perhaps. So if I choose one on polio, you're going to mention this. It's caused by poliovirus. The route could be fecal oral, like food poisoning. or contact with infected saliva or mucus. If you pick this virus up and have a good immune response, no symptoms, a fair immune response, abortive polio, just say this much: you'll feel very sick for a while, have no paralysis. With a poor immune response, you get paralytic polio with some degree of paralysis. And mention this: paralytic polio can be fatal because of respiratory failure. Stop breathing. Looking for those things if I choose that one. Now back to multiple choice where it says rabies. Rabies is basically always fatal because of overwhelming encephalitis. The rabies shots include RIG. Rabies immune globulin is a shot of antibodies to fight that virus, antibodies. HDCV is the inactivated rabies vaccine, not attenuated. It's the inactivated vaccine for rabies. Encephalitis can also be caused by a virus called the West Nile virus. Here, with a good immune response, you have no symptoms. A fair response, you get flu-like symptoms. A poor response, you get encephalitis. Chapter 23, cardiovascular. Gas gangrene is caused by Clostridium perfringens. The first step to getting this is ischemia. The blood supply, the part of the body, cut off. Step 2 is called gangrene, the death of tissue due to lack of blood. Step 3 is called gas gangrene. You have gangrene plus a bacterial infection caused by Clostridium perfringens. I'm going to leave a few details out, but why can gas gangrene be fatal? Overwhelming what infection? The bubonic plague is caused by Yersinia pestis. The reservoir is rats. The vector is fleas. Why can the plague be fatal? Subcutaneous hemorrhage. Lyme disease is caused by Borrelia burgdorferi. The reservoir is field mice. The vector is ticks. The complications here include arthritis, meningitis, encephalitis, irregular heartbeat. Chapter 24, respiratory system. Diphtheria is caused by Corynebacterium diphtheria. A pseudomembrane forms in the back of the throat that may block air passageway. So connect those terms: diphtheria, pseudomembrane. The common cold can be caused by about 200 different viruses. The most common cause of the common cold is the rhinovirus, followed by adenovirus, and then coronavirus. Influenza is caused by viruses called influenza A, influenza B, influenza C. Most common cause of this is influenza A. The swine flu is caused by a new strain of influenza A virus. Bacterial pneumonia can be caused by lots of things, including MRSA, methicillin-resistant Staph aureus, a hard-to-treat strain of Staph aureus. Pertussis, or whooping cough, is caused by Bordetella pertussis. These bacteria target for infection the cells that line the trachea. You wind up with mucus globs trying to cough out of your trachea. Connect pertussis and trachea. Tuberculosis is caused by Mycobacterium tuberculosis. The first time you're exposed to this is called a primary infection. With tuberculosis, the primary infection produces symptoms only with a compromised immune system. Unfortunately, this bacterium survives inside our macrophages. With tuberculosis, traditional phagocytosis doesn't work. So instead, we try to wall them off with white blood cells. You may wind up with lesions called tubercles in your lungs. Later in life, the bacteria may manage to escape the tubercles. If they do, that's a reactivation infection. With tuberculosis, the reactivation infection produces symptoms always, no matter how strong you are. The PPD test is a TB skin test. It's a test for T cells for TB. If you're exposed to TB there, positive, then do a chest x-ray. The chest x-ray shows lesions or tubercles, then take treatment, TX, that's for rifampin and INH, for at least 6 months. That should make the tubercles heal or calcify. So a healed tubercle is a gone complex. The bacteria in a gone complex are all dead. Viral pneumonia can be caused by RSV, respiratory syncytial virus. The most common cause of pneumonia in babies is RSV. SARS, severe acute respiratory syndrome, is a dangerous and sometimes fatal pneumonia. It's caused by a new strain of the coronavirus. Chapter 25, the mumps. It's caused by the mumps virus. They target for infection the cells of the parotid salivary glands, and they swell up. The complications could be meningitis or bronchitis. Now, under hepatitis, that whole chart is fair game. So know the route, the percent chance of being a lifelong carrier, the chronic liver damage, yes or no, liver cancer, yes or no, and the vaccine type, if there is a vaccine. There will also be multiple choice questions. Now the top right and chapter 26. Chlamydia is caused by Chlamydia trachomatis. The complications include sterility in females. The cure is antibiotics. Gonorrhea is caused by Neisseria gonorrhea. The complications include eye infections for a baby. The cure is antibiotics. Syphilis is caused by Treponema pallidum. The complications for stage 3 include insanity and death. The cure is antibiotics. Genital herpes is caused by herpes simplex 2. The complication, not too common, encephalitis. The cure is none. Genital warts are caused by HPV, the human papillomavirus. The complications here include cancer, especially cervical cancer in females. The cure sometimes can work is aggressive removal of the warts. AIDS is caused by HIV. The complications include numerous secondary infections, particularly tuberculosis, pneumonia. Also death is a complication. The cure is none. If you have questions, I'll be around doing the makeup. I'll be around. Otherwise, see you next week. Don't forget to record.